Sclerotherapy is a procedure that we use to treat the spider veins or the smaller varicose veins on your legs that may cause problems like bleeding. It's a pretty straightforward procedure that we do in our office. It is a little uncomfortable. I tell patients it feels kind of like getting a little ant bite, but the pain is very short-lived and it certainly does make a difference. Basically what we do with that procedure is we inject a medication that scars down the walls of the vein and causes it to close down over time. Typically you need multiple sessions for this, so I'm always very upfront with patients on that they need to expect to have at least 2 to 3 treatments, and usually they're 4 to 6 weeks apart. It takes us that much time between treatments to see how effective the treatment was. So when you're paying for this cosmetically, you just need to kind of budget for that and expect to have multiple treatments. Side effects of sclerotherapy, it's pretty straightforward, but a big thing that can happen is something called hyperpigmentation. So it looks like you trade a purple vein for an area that looks brown or bruised. That is typically temporary, but it can be permanent. So we always do everything we can to prevent that by asking our patients to keep your legs out of the sun for about 2 weeks after treatment, and to make sure that you're wearing compression for at least 5 days after treatment. Other side effects is really need for more sclerotherapy. Severe side effects can include ulceration, where you develop a wound on the leg where the injection was. Again, our approach is to be very conservative to prevent all of that from happening.